And again, you're watching Kay Burley at breakfast. 80 people now known to have died from the coronavirus in China, with nearly 3,000 others infected. Joining me is Dr. Yvonne Doyle, Medical Director and Director for Health Protection for Public Health England. Hello to you, thanks for joining us. Do we have a plan to track the 2,000 or so people who've actually arrived from Wuhan recently? How do we do that?
Well, Kay, what we've been doing since we spotted that this could be a big problem is intensifying our work on this in a number of settings, including in airports. So when it became clear that direct flights were coming through regularly, not just from Wuhan, but from other parts of China where there could be infections, we've been ready with a team of doctors to meet those who meet our criteria, really, for if they may be ill with something that needs further investigation. And of course, the case definition, the kind of criteria for that are that somebody has a fever, a cough, difficulty breathing, and has been connected with Wuhan in the past 14 days. Now, the people who you're describing here, we are now looking back to see whether any of them are still in the country, because some of them will have returned to China, but there are moves to identify them. Not always possible to find everybody, but we're working to our best endeavours.
The problem is, though, Doctor, I mean, I was in Helsinki yesterday. There were flights coming in from Beijing and Tokyo and other parts of the Far East. Those off the flights were wearing their masks. One wonders how effective those masks are. But it's not just Wuhan anymore, is it? It's very quickly able to spread this virus. And the fact that it has an incubation period of a couple of weeks. So you don't even know people had it until perhaps they've left the country.
Well, we're learning a lot about the virus. I want to say we're well prepared, Kay. So, as I say, since we spotted this in the early new year ourselves, we've been intensifying our work across government, but also with the NHS. Because our view is actually, although airports seem important, the most likely place that we may find a case is someone who's in the country already. And it's absolutely critical that the Public Health Service and the NHS are ready to both diagnose that and then to designate the person to the right facilities. Now, we've set all that up, and I think I want your viewers to be reassured that we and the NHS are ready for that. That's the most likely scenario we're dealing with.
But we don't know where all these people are, though, do we? It's impossible to know where they are in the country, whether they're even still here.
We make our best endeavours to do just that. But as I say, people will have returned, of course, within the 14 days. They may have been here for short periods. But to come back to airports, although we have a lot of work going on with the airport, the main airports where this is relevant, the most likely situation, if we get a case, is that the person is in the country.
What about these masks? I touched on that. Are they in any way effective?
Well, masks are very important in hospitals, and they, particularly in ITU, in the intensive side. But whether they're of any relevance out on the street, because people forget how to use them properly, what's much more important is that people are aware of personal hygiene, hand washing, and the catch it, bin it, kill it. Back to the old public health adage that, you know, if you're this is probably a respiratory virus, so droplet infection important. Use a tissue, throw it away, wash your hands. That's actually more effective.
Yeah, and I always say don't touch metal, because metal, the bugs can live for longer on metal than anywhere else. Is that just an old wives' tale or not?
Yes, I mean, people will be wary of what they touch, but actually the important thing is it's droplets and hands.
Yes.
So keep your hands clean.
Okay.
Wash them with soap.
Okay. I'm guessing, though, you know, to all intents and purposes, we will have some cases of the coronavirus here in the UK already.
I would expect so, and that's coming back to the point that that's the scenario we have been preparing for, that we are ready. Don't assume because this is a virus that we can diagnose it immediately. Our scientists actually have developed a screening for viruses that will detect this. They're one of the first countries in the world that are able to do that. That's hugely reassuring, and the tests are being transmitted through a particular lab that has that expertise. Once you've diagnosed it, then we have a path for how to deal with it so that patients are dealt with in the most effective way.
And you're not alarmed that it's probably here already?
I think with infections, Kay, health is global. And we've been here before. You know, we had to deal with this Middle Eastern virus. We've dealt with SARS. We deal with flu regularly, which can be very alarming as well and very, very dangerous. So we're ready. We've got a very good infection service.
OK, Doctor, it's good to talk to you. Thanks very much indeed for joining us.
Thank you.
Thank you.